In addition to putting into action this framework of addressing internal to external considerations, healthcare providers can put other motivational interviewing techniques to good use. These include ask permission to discuss, assess readiness with a conviction confidence ruler, use an ask tell ask approach, express relationship building pearls, roll with resistance, avoiding debate or pushing back on a defensive stance, reflect, and deliver personalized message, such as, I'm really concerned about long haul COVID for you, rather than, long haul COVID is a risk to your health. Let's talk more about 3 of these: the conviction confidence ruler, the acronym PEARLS, and what we mean by reflect. Assessing conviction and confidence is a practical way of assessing a patient's readiness to change, as well as guiding the direction of counseling. To assess conviction, you might ask, on a scale from 0 to 10, where 0 means not at all, and 10 means you already booked an appointment, how convinced are you that it is important to receive the COVID vaccine? Assessing a patient's personal sense of confidence is a similar but distinct question. Even if a person is convinced that the vaccine is important, they may lack the self-efficacy to make it happen. In this case, you may ask, on a scale from 0 to 10, how confident are you that you'll be able to successfully receive the vaccine? Next, let's give some examples of pearls. The first letter is P for partnership. An example statement is, we are working together to solve this. E is for empathy. You might say, so it sounds like you've had a hard time trying to decide what to do about the vaccine, and it's been worrying you. A is for apology. I'm sorry you are frustrated. R is for respect. I respect you've thought a lot about this. L is for legitimization. You have experienced frustration about not being able to get together with loved ones. That is difficult. S is for support. I want to offer as much support as I can. Finally, for patients who are not ready to change, reflection is a significant and valuable skill. Imagine a field of wildflowers and weeds. The green weeds represent reasons against change, while the red wildflowers represent positive change talk. The clinician's job is to listen for the wildflowers that pop up in a patient's conversation and selectively reflect them back to affirm them, much like presenting back a bouquet of flowers of the patient's own positive desires. The change talk to listen for is when patients express their desires, such as, I wish I could get the vaccine, but then reflect back, you'd like to get the vaccine. Abilities, I probably could get the vaccine if, then reflect back, you could get the vaccine. Reasons, I bet I'd feel better if I got the vaccine, then reflect back as before. Needs, I have to get the vaccine because. By evoking and selectively reflecting desires, abilities, reasons, and needs, the vision and intention to change can strengthen. Thus, the first step is to recognize change talk and affirm it by selectively reflecting back. Next, we'll demonstrate examples of integrating these considerations and techniques in animated patient encounters with each of the 7 personas. We'll see you there.